To date, we have done 50,000 tests, 50,219. We had a very interesting discussion earlier today because you got 50,000 tests, you got 1,500 people who are positive. Is it worth the effort? And actually the truth is it is. It is worth the effort even if we test several millions of people and found only a couple of thousands of people. The reason why it's worth it is because the devastation of a COVID-19, which is unmanaged and uncontrolled and undetected and undiagnosed, is actually far worse than the cost of testing the many people. So you must know we will need many more people to be tested, and it is worthwhile even if we found most of them negative, because we've got a clear picture of where the problem is. Today, America is beyond 200,000. If you're talking about the whole world, we're at about 900 and close to 1 million people who are affected. The mortality, if you look to the rest of the world, is high. So we do need to test and actually map the pattern of this infection in a way that's going to make us to be able to deal with and reduce the impact on our own people. And we are even prepared to try approaches that may not necessarily have been tried by others, just to make sure that we save our people, so that at the end of the day, our South Africans can look back and say there is something that we have learned, there's something we can share with the world, and out of all of this, we want to say it doesn't matter how much money we're going to spend in fighting COVID-19. We've seen the devastation in other countries, and that amount of devastation, we don't wish it to our own country. And therefore, the cost that's associated is worth the while. And so we want to just say we continue to have a commitment, particularly from the point of view of our health workers and our government leadership, community leadership. We really are determined to fight this. We want to call upon all our people to observe the lockdown. Stay at home, keep social distance, protect yourself where necessary, where possible. Let's just make sure that all of us, when we're asked to come forth for testing, we must make ourselves available. But we will continue to fight COVID-19. As far as we're concerned, it is possible for South Africa to chart a path that defeats this outbreak. It's up to us. It's not up to the virus. It's not up to the outbreak. And that's the message we want to leave with you. Thank you very much.